New COVID-19 variants are taking hold here in San Diego County, with recent case numbers rivaling what we saw last summer. So what's different about this latest surge, and why is it spreading so quickly? For answers to those questions, we turn to the people at iNewsSource who crunched the numbers. Danielle Dawson is joining us today to talk about it. Welcome, Danielle. How are you doing?
Thank you. I'm doing excellent. Thank you for having me.
Good to have you here. What is going on with COVID right now in the county? What are the numbers telling us about where we are now and where we may be going?
Yeah, so right now we're currently seeing an increase in the number of positive cases being reported by the county. We have since the beginning of May. So right now, we've seen a couple days in the past couple weeks rivaling, the Delta surge last summer in numbers. We saw a couple days with over 1,600 positive cases, which experts say is an undercount at this point.
Right, and that's what's different from last year, is that we have so many more home tests going out that it could be a significant undercount. Yes,
exactly. So, obviously that's an important thing to consider when we're looking at moving forward.
And we've changed our lens over the years with COVID. We know cases are important, but it's the downstream effects, hospitalizations and deaths, that are really concerning. Compared to last year, roughly where are we?
Yeah, so we have seen a lot less hospitalizations and deaths in the last couple weeks. I think during the Delta surge, the highest number of deaths on a single day was around 100. Right now it's around 30.
Okay.
Hospitalizations, not deaths. Okay. So we are at a point where, we're seeing a lot more transmission, but, it still is relatively mild compared to the Delta variant. However, BA.4 and BA.5, in the way that they are, more transmittable and even more able to circumvent any built-up immunity that someone might have, experts are concerned that this could change in the coming months.
And BA.4 and BA.5, for our viewers, those are just starting to those are the latest variants that are starting to take a foothold here?
Yeah, so BA.4 and BA.5 just kind of emerged on the scene a couple, weeks ago in early May. So those have quickly taken hold. Right now, we're at a point where it's about 50% BA.4, BA.5, and then the previous iterations of Omicron. So we're seeing the numbers increase in terms of their prevalence.
How are vaccines dealing with these new variants? Vaccines are based on previous strains. Are we at the point where the new strains are avoiding, to a certain extent, the vaccines?
It's still a little unknown just because of how new these variants are, but experts across the country are working to figure that out. But the experts that I spoke to were concerned that, we're seeing a lot more people who have been avoiding, infection for 2.5 years, and now they're getting the virus. And a lot of that has to do with the fact that the vaccine effectiveness wanes over time. So, people who might not have had a dose in the last couple of months might have a weakened immune system compared to when they first got their vaccine.
And that not only means people will be more likely to catch it, but their symptoms, does that mean their symptoms could be a little more severe as well?
It's still hard to tell.
Okay.
But, the way that this virus is behaving, you still can get very sick even if you do have a vaccine.
Yeah.
So vaccines are the best way for you to protect yourself and ensure that there is, less complication or potential fatality with getting COVID. But it's still hard to tell just because of how new these variants are.
So what do people need to do right now? What do county health officials want people to do to try to slow this? Even though we're not seeing high numbers of hospitalizations and deaths, there's still real concern with this pandemic. What do we do?
Yeah, so like I said, vaccination is incredibly important, and all the experts that I spoke to reiterate that it's still the #1 best way to protect yourself and strengthen your immune system. So if you haven't gotten a vaccine in a couple months, or if you're not totally up to date, experts are saying that you should seek out a vaccine or a booster. So if you had your booster already, you should check the county website to see if you're eligible for another booster at this point.
Danielle Dawson with iNewsSource, thanks for joining us today. Your first time on TV, I'm told?
Yeah, thank you so much.
No, thank you for bringing this very valuable information to us today. We appreciate it greatly, and great job. And I want to tell people, iNewsSource, check them out. It's a nonprofit investigative website. They do great journalism here in San Diego. They are a San Diego startup. Once again, a nonprofit. Go to inewssource.org to read all the incredible stories that they have, but you could also help them out with the donation.